Why infection control important to healthcare workers? Infection is one of the leading preventable deaths in hospitals every year. The Center of Disease Control and Prevention estimated that there are 2 million preventable infections in hospital every year, leading to 90,000 unnecessary deaths. Regardless of work area, preventing the transmission of microorganisms is the concern of all nurses. One way in which a nurse accomplishes this goal is by asepsis. A large number of microorganisms live and multiply on every surface. Infections can be spread within healthcare setting, whether patient to patient, from patient to staff, from staff to patients, or among staff. What is infection? Infection is the invasion of bodily tissue by pathogenic microorganisms that proliferate, resulting in tissue injury that can progress to disease. The invasion of multiplication of microorganisms such as bacteria, viruses, and parasites, those are not normally found within the body. An infection may cause no symptoms and be subclinical, or it may cause symptoms and be clinically apparent. An infection may remain localized, or it may spread through the blood or lymphatic vessels to become systemic. What is infection prevention? It refers to policies and procedures used to minimize the risk of spreading infections, especially in hospitals and human healthcare facilities. Infectious diseases kill more people worldwide than any other single cause. Infectious diseases are caused by germs. And germs are tiny living things that are found everywhere in air, soil, and water. Person can get infected by touching, eating, drinking, or breathing something that contain a germ. Germs can also spread through animal and insect bite. For instance, the mosquito that is famous for malaria and dengue. And also bite of dog or cat. Kissing and sexual contact can also be a cause of transmission of germs. Vaccine, proper hand washing, and wearing PPE, being clean all the time, can help prevent infections. There are 4 main kinds of germs. One is bacteria, like this one here in the picture. And then viruses, just like what we have right now, the COVID-19, okay, that can really lead to death, fungi, and protozoa. Okay, those are the main kinds of germs. And there are types of infections also. Number one, types of infections are, number one, primary infection. Initial infections with an organism to host constitute primary infection. Number two, secondary infection, when a host resistance is lowered by pre-existing infection. New organism may set up a new infections. Okay, number three, local infection. Infection that is limited to a defined area or single organ with symptoms that resemble inflammation like redness, tenderness, and swelling. Number four, systemic infection. It is an infection that spreads to whole body resulting in septicemia. Number five, acute infection. It appears suddenly or lasts for a short time. Number six, chronic infection. May occur slowly over a longer period of time and may last months to years. Iatrogenic infection. Infection resulting due to therapeutic and diagnostic procedures. And last, number 8, nosocomial infection, also known as hospital-acquired infection, is an infection that contracted from the environment or staff or a healthcare facility. It can be spread in hospital environment, nursing home environment, rehabilitation facility, clinic, or other clinical settings. Infection is spread to the susceptible patient in the clinical setting by a number of means. Healthcare staff can spread infection. In addition to contaminated equipment, bed linens, or air droplets, the infection can originate from outside environment. Another infected patient staff that may be infected, or in some cases, the source of the infection cannot be determined. Since microorganisms cannot travel on their own, they require a vehicle to carry them to other people and places. Infectious diseases and even certain contagious diseases spread through the following agencies. Their ways of spreading is also given along with these agencies. Number 1, airborne transmission. Like the Ebola. The Ebola is a very good example for airborne transmission. Okay, number 2, contact transmission. It can be direct and indirect. Number 3, vehicle transmission. It uses like water or milk or food, etc., where they will be, you eat it or drink it, you will be able to what? Get the the germs or the microorganisms. Another one is vector transmission that you can get from animals, okay, from the bite of the animals. Number 5, transplacental transmission. Example of this is, they said in my reading, the SARS. SARS can be transplacental transmission while the mother is pregnant. It can be transmitted to her baby. Who is at risk of infection? Number 1 is staff, of course, because they are exposed to potentially infectious blood and other body fluids on daily basis. Number 2, clients. They are at risk of post-procedural infection. If providers or healthcare providers do not wash hands between client and procedures. When they do not adequately prepare client for procedures, and when used instruments and other items are not cleaned and processed correctly. Okay? And number 3, community. It is also at risk of infection, particularly from inappropriate disposal of medical waste. So nurses should learn how to do proper waste disposal. Okay? They have to refer to the item that they have bought, to the agency. Okay, of course the agency will put the instruction on how to dispose this kind of contaminated items. Clients in healthcare setting may have an increased risk of acquiring infection. Hospital-acquired infection results from delivery of health services in the healthcare facility. A hospital is one of the most likely places for acquiring infection because it harbors a high population of virulent strains of microorganisms that may be resistant to antibiotics. The ICU also is one area in the hospital where the risk of acquiring of HARI is especially high. When health practitioners or workers are responsible or concerned, he or she will follow infection control procedures by hand washing properly and regularly, by using gloves, by using PPE, goggle, and face mask and face shield, and also by maintaining sterile field. Thank you very much.